do this to you all, right?
And you think that's me?
I'm doing it to you.
Okay, now, what am I supposed to do?
I don't, it was like, you didn't know, because it could go either way. It could either be like, I'm trying to intimidate you right now, or I'm just trying to be funny and joke around with it. I'll let you decide where I'm going.
Well, knowing you, I know it's probably going to be on a high level, probably just funny.
Exactly. Yeah, that's the first time. I know, right? The first time he did it to me, I was like, oh.
The meeting of the Health and Human Services Department Board order for Wednesday, October 7th. Due to the COVID-19, this meeting is conducted under Waupaca County Resolution Number 8, 2020-21. And Governor Receiver Message Order Number 1. It might be Order Number 2 right now. Please note that the following information. The meeting is broadcast for remote access on live stream on YouTube, and that particular call letters there. This meeting may inadvertently cause the forum of other county committees or the county board of supervisors, no business decisions or any other committees or the board of supervisors will be conducted at this meeting. Participation in person is permitted. This meeting will be conducted using CDC and DHS guidance regarding social distancing. Tables and chairs will be arranged accordingly. Face coverings are required unless an exception applies. And this meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with the Wisconsin statute, so that the citizenry may be aware of the time, place, and agenda of this meeting. We have the roll call sheet. I hope everyone got it. It was down at that end before the doctor came in, so. Okay, good. If you want to take a look at the agenda as written, if there's some, Jan?
I'll make a motion to accept it.
Okay, Dave seconds it. Those in favor, signify by saying aye.
Aye.
Okay. Then we have the minutes of the previous meeting, September 2nd and September 9th, 2020. Any comments about those meetings, or the minutes, not the meetings, but the minutes? If not, Jan?
I'll make a motion to accept the September 2nd and September 9th, 2020 minutes.
Okay, is there a second to that? Sue? Made the second to that. Any discussion of those minutes of either date? Hearing none, those in favor as written signify by saying aye.
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 And they are passed as presented. Then we go on to public comment. Any public comment? Seeing none, move on. General board business, public health COVID-19 update.
So I'll start with a
just kind of an update on where we're at kind of case-wise using our dashboard. Like most of our region and the state, we've definitely been going through a surge in cases. The last few weeks have just been extremely busy. Every 2 weeks, we kind of look at our trend for new cases. This last 2 weeks, we've had 507 new cases. That averages about 36 cases per day. And if you look at our burden, that puts us at 994 cases per 100,000 total, and a burden rate of about 70 cases per 100,000 on a daily average. So,
Can you speak louder, please?
Sure. So do you want me to repeat, Pat, or?
Yeah, just the ending was sort of.
Oh. Okay, so we had 507 new cases the last 14 days, which averages to about 36 new cases a day. Our burden, which is your rate per 100,000, would be 994 cases for that 2-week period, and that equals about 70 cases per day as a rate. And so that puts us in very high levels with all the state metrics and some of the national metrics, along with the rest of our region and most of the state. We currently have 335 active cases, and we have 22 deaths. We reported a new death actually today. The other thing that's been very alarming is just the hospitalizations. Our region, all the healthcare providers are basically saying that they are running out of room as far as beds, and they're having problems with staffing. Data Care last week noted that system-wide, they had, in a single day, they had over 250 staff out, not able to come into work. Here's a graph of hospitalizations, and this changes every day. And actually, I just looked at this today, and so yesterday there was 84 total, and we went up to 90. So just today, 6 new hospitalizations for Waupaca County residents. And if you saw the governor's press release today, or press conference today, the state is going to be opening up their alternative care facility at the state fairgrounds to help with beds and folks that need to be hospitalized. There's some criteria of who will be there, who's eligible to go there. But that's largely driven by the Fox Valley area and the need for beds and for alternative care for folks. So we're definitely in a bad spot right now with COVID. We've been surging, and we're definitely feeling the effects of it. Early this week, and I did send it to all the county board members, I sent out a public health alert notifying that we are no longer able to contact trace like we have been throughout the pandemic. We can only, at this time, we only have the capacity to contact positives, and some contacts, but we're not able to do full contact tracing. So there's going to be instances where we're asking people that are confirmed cases to contact their own contacts and notify them, because we no longer have the capacity. All of our staff are dedicated right now just to getting hold of positive cases. And when we have, like this weekend, we had 112. So we had 4 people on cover this weekend, and all 4 had to work through 112 cases this weekend, and that definitely stretches us. So that's kind of where we're at as far as our response. I have another thing I can show you too, just to kind of put in perspective. Oops. This will let me share. there we go. This is the Harvard Institute's map, might be a little hard to see, but they have set some metrics of, what high levels are based on daily cases. And you can see Wisconsin ranks third right now in our rate. And if you even expand that, you can see where Waupaca, you can see the whole region here is kind of in red. And Waupaca, I think, was in the top 10 or so in the state. Or maybe not. Did I miss it? Right here. So we're in the top 10 with our rate, which they have at 86.1. So we're definitely, not only is the state extremely active, our region extremely active, and we continue to be high, really high in the metrics that are available. So that's definitely been concerning. The governor did issue an order on mass gatherings. So we'll work through that. Not exactly sure how we're going to manage it right now, but I'll be working with the DA to see if, what steps we'll take in regards to that. Just an update on schools. So I meet with the school administrators regularly. We always meet at least once a week on Wednesdays. We met this last couple of weeks. We met a couple times. We do have 2 school districts right now that are fully virtual. That's New London and Clintonville that started this week. And next week we'll have a couple schools that are going to shift to all virtual. All the other schools this week are in an AV cohort schedule. So we have 2 cohorts for like secondary level. They'll come this class on Monday, Thursday, and then the other group will be Tuesday, Friday, and then Wednesday is a virtual day. So all the schools are if they're not virtual, they're in a cohort classroom setting right now. And a couple of the school districts are probably going to be shifting to all virtual next week as well. So, and it's not necessarily a reflection of what's going on in the schools. The schools people ask me what are the sources? Why are we seeing the surges that has anything to schools? I don't think it has anything to do with our schools. We aren't really seeing spread within the schools. They're affected by what's going on outside the schools with their staff or with their students. And then it's potentially brought in. But anytime we've had a student or a staff, the school has been have done an extremely good job on mitigating and contact tracing. So to the point where we don't have spread that's actually happening within the schools. So they've done an outstanding job of putting in everything they possibly can as far as protocols and practices. And when they have had situations, they've responded quickly and they've been able to mitigate so that it hasn't gotten to any bigger levels. I think it's just a reflection of the community spread and that's affected the schools. But I definitely don't think the schools are what's contributing to the community spread. I guess I'll leave it at that then for updates and take some questions. Yeah.
Can you tell me who determines when testing is going to be done? Like in why we got, at the fair.
Oh, at the fairgrounds?
Yeah.
So we put in requests, which we have to do through emergency management to the National Guard. And so we've done 3, actually, we've had 4 of those. And we have to put in requests and then it goes through an approval process. So right now with the testing sites, Oshkosh has its enduring site for our region. We're in that region, the Fox Valley region. And that's 6 days a week where they're having that. And the National Guard now has started to kind of switch up their strategy where they're putting together smaller squads to be able to do more sites. And we've requested for a weekly site to come to the fairgrounds. And I anticipate that to happen. We don't have, I think we got some preliminary approval actually today. Don't have dates set on that yet, but that's what we're hoping for. And so those squads, which are smaller groups of National Guard, are going to move throughout our area, our Fox Valley area. We have the enduring site in Oshkosh. So Shawano County may have them for a day. every other week. Washera County may have them for a day. We're gonna hopefully have them for a day every week and kind of move around our area with those smaller squads, and then along with that endurance site in Oshkosh.
And then one other question. If you test positive, and maybe Dr. can answer that, an individual fell over in the bathroom for whatever reason, they took her to the hospital and treated whatever injury she sustained, and then tested positive, but send her home. Why did they do that?
I wasn't there, but my thought would be you can be positive, but asymptomatic from a respiratory standpoint, so that they didn't overwhelm their system. Whether they treated her for the acute problem, sent her home to be quarantined unless she progressively worsened. But if they put every person in that's positive, they'll just get overrun real fast. But
I was just wondering about that because it happened to a friend of mine. So.
Any other questions for Jim?
Jeff, what do you think is the major reason for the numbers going up so high?
It's hard to say, but I mean, I think it's just a combination of, honestly, it's a lot of it just not following the recommended guidelines, masking, social distancing, not going to gatherings. We have, I think I wrote down, right now we've had a total of 60 outbreaks, 29 active outbreaks. We do have several worksite outbreaks, but we've had plenty of outbreaks, related to weddings, to other types of gatherings where maybe that's, if you heard this term super spreader, I mean, those are the type of events where one person infected can infect a lot of other people at those gathering indoor spaces. And you get a combination of some of those going on, and then I think the whole area having those types of goes on, and it just snowballs. So I think some of that has to go with it. I mean, we started seeing this surge when colleges opened up with the 20-year-olds, and that certainly started it to a certain degree. Now that's started to trend downwards on the campuses and everything, but that was kind of something that definitely we were seeing a lot of 20-year-olds, and we were seeing it in Waupaca County too. But I think that's kind of slowed down a little bit, but that may have contributed to start out with. But I think there's just a lot of lack of maybe COVID fatigue and not always, doing some of the things that we're always asking people to do. That's face coverings and avoid gatherings and social distancing.
Anyone else? Jed, I have a couple of questions based on your presentation today. One question has to do with this: if we receive the weekly okay at the fairgrounds, is there going to be restrictions like you were here last week, you can't come this week?
No.
No.
Anybody can come in.
Okay. And the other thing is, I was reading in USA Today yesterday about the type of tests that they are using in some other parts of the country. And it still used the swab in the nose, but they were able to place it and get an answer in 13 minutes.
Sure.
Is there any chance of speed up of?
Those supplies are starting to come in, the ones that were supplied by the federal government. So long-term care facilities got those are called point of care testings or antigen testing. And they're rapid, not as accurate as kind of the gold standard PCR testing. So in cases you might have to do confirmation testing along with it, but you're going to get an answer right away. It's better than having to wait 5 days and getting answers. So I know long-term care facilities have them. Healthcare facilities are starting to get them. Maybe doctor can add to that, and that will certainly help with speed and give us more information faster and be able to give people treatment or diagnosis sooner. I think there's going to be more opportunity for those as time goes on that there will be more available. I think they're just starting to become more available on a more widespread availability. Doctor, I don't know if you got.
It's trickle down effect, general population, if you're just trying to move it out, they're still doing a nasal swab, which is cost effective as well. So it's in our area, we're just not putting it out to everyone, otherwise everybody will run and get the test done. Right now, I think there's like a 3-hour wait, I think, in Oshkosh, at least. I guess my question was too, is how many different counties are going to that one specific site?
In our area, most of our surrounding counties are going, they've sent some statistics on how many counties are going, but they're getting people from all over the state. They'll have people from Milwaukee drive out there. I think last week, the stats I saw from Waupaca County, roughly around 3% that show up at that site are Waupaca County. I think I did a quick thing on total tests that they did in one day and the percentage. And one day, there's probably about 35 people from the county that went to Oshkosh in a single day.
Anyone else?
I can, just to add to that, the other day, they did 1,200 tests, and my doctor said they have long lines right now. It can be up to 3 or 4 hours. So we're really hoping those squads and regional sites are added.
Okay, well, thank you, Jed, for your very, very thorough report to us about the progress or what's happening with the COVID. Okay, moving on. The advisory committee reports update. Had a chance to look at those. Then we have the nutrition council, also minutes from the 24th of September. Anything to add to that, Jim?
All that I can tell you, she'll probably be embarrassed, but Melissa has been doing a fantastic job since the change of her. And so I can't complain, and I can't, I only can say she's doing a very good job.
Good. Thank you, Melissa.
Yeah, thank you.
Certainly, Melissa was not unexpected. We know you've been constantly doing a good job. Thank you for continuing. The next is the unit updates. Is there anything that you like to question or about that unit update? It's on your thing as department update, but Jan?
I went over it, and I don't know if this is the time to bring it up. On the CCS and CST, I know there's changes up in that department according to this slip, but I drove 215 miles to Munson for a meeting, and I was very embarrassed. I'm the only county board supervisor. No members from our CCS or CST was there in attendance or on Zoom. And I was embarrassed because they go around and ask what's happening in your area. And I can't give a report because I was told to sit there and listen. And then I could say, well, we're working on a budget, and we have some flux in employees. And I don't know if the department, I don't know, Cherie never showed up, or that, what's her name, that new girl, Lecter, she never showed up. And, you know, when I drive 115 miles one way and back, it's embarrassing sitting there and not having representation when we're a 6-county board, or not county board, but 6-member counties represented. And it would be nice if they would notify me if they're coming or if they are not coming, or give me some material to bring up at those meetings.
We can have that conversation again. Jan, was it worthwhile?
Pardon?
Was it worthwhile?
Driving over the scenery was excellent.
But that presentation,
Well, all that I could say, we did have the two lay people, and I call them lay people, the people that belong to this group. They did give their update, and again, it was brought up, not the continuity if someone leaves or if someone's out sick. The big issue is follow-up with these clientele, because these people are special people. They aren't like you and I. And when they get turned off from having a social worker that leaves, their care gets erupted. And they really, you know, it takes a while for them to develop a trust with people. And, but they would like to have information saying, well, I'm sorry, Jody is not going to be here tonight or for a couple of weeks. They don't even know why, but Joe is going to take over your case for a while until Jody can come back. But we need to have continuity and follow-up, which is lacking in that department.
thank you, Jim. The point D, contract update.
Yeah, just a quick update there. You know, the contracts with the two providers in the nutrition program, Sewers and Stephen Mary's, we have been doing the contracts every 3 months until the end of the year, and they're due for extension to the end of the year at this point in time. There's no changes in the contract. It's just the same dollar amount, the same service, those kinds of things. So those are up for renewal.
Okay. Yeah,
I'm asking this question only because when I watched the nutrition advisory committee on aging, the person from the northern part of the county, and I'm referring to Stephen Mary's in Marion, felt that it wasn't fair that they were getting paid a lower price than Schuler's when Schuler's requested an increase and got one, and also cited the cost of groceries and those kinds of things. So I guess my question is, did the vendors send in what they wanted to do, or did we simply say, we're gonna renew you at the same time? Because this gentleman said, you guys gotta treat them fairly, and quit or resigned or something off of the Nutrition Advisory Council. And he had gone to ADRC with me, and I know he's a, caring gentleman. And so my question is on these contracts, was Stephen Mary's given a chance to up it so they can help pay for the cost of groceries that has increased?
That's
Maybe
my knowledge.
Melissa.
That's my knowledge. They have not had contact with us.
Well, they have not asked for that specifically, Pat, but I have met with both of those vendors and asked what their thoughts were if we were to extend the contract as it is right now to the end of the year. And both of our vendors said that they were in agreement to that and that was okay with them. Did I open it up and ask them if they, as far as the price per meal? We did not have that conversation. They did not. They didn't ask.
And then come January 1st, when we redo it, that will be their opportunity to then come in with
Yeah.
revised prices if they so choose.
Yeah.
If they don't, that's terrific.
Yeah.
Thank you. That's all I need.
okay, moving on to finance, income statement overview. Had an opportunity on your iPad to see that. Are there any questions or observations about?
I can just make if I can make just a couple of highlights for everybody. This income statement reflects those budget amendments that we brought to the board for approval, those resolutions for the additional grant. There was some additional grant funding, some decreases. So that's reflected in this income statement now. our tax levy for health and human services is not yet reflected in the budget, in the snapshot that you're seeing. So that's definitely a component that is impacting on the revenue side. And then I would just only want to highlight one other thing. I know we have talked about continued concerns about what our revenues look like. The target percentage at 54% for revenues and the target percentage for expenses at 67%. I just want to note that the gap in those percentages there is 6% for revenue, while our expenses is 12%. So we are double underspending, on our expenses than what we're bringing in for revenue. So if we're not going to be bringing in as much revenue as far as expenses, at least at this snapshot, we're in an okay position, as best as you can be in COVID, I guess.
Did you say that tax revenue is not given to us yet?
Correct. I
And then
believe
the
it's in
next-
September.
Then the question becomes, because from the county treasurer, the towns, cities, and villages get their payments back from the treasurer as to when they buy up the taxes. And I collected that money in January for the county portion. Why isn't Health and Human Services getting their share of what we've already paid? Why are we having to wait until September when everybody else got paid out in August? And towns, cities, and villages have collected that first money back in January, and we settled with the county treasurer for us, in February, so.
Right, that's a good question. I don't know the exact answer. That's handled by finance, Heidi's department, when they actually allocate that out. So I don't know as far as processing, what's the time and effort that goes into having that accomplished. I'm not exactly sure.
Okay, so I can ask Heidi.
Yeah, thank you.
Any other, yes, Jen?
Erica, what about the individual without divulging confidentiality in Tennessee?
We're not in council.
Oh, I thought that was, okay, I'm sorry.
Okay, anything further on the income statement? Going on to the payment register, or as we,
That's
Yeah.
the individual that's in Tennessee and the traveling.
Yes, so I'm assuming that you're seeing the payments. So those are the credit card charges that were for prior travel. So those procurement credit card charges are really delayed in coming through. I'm actually not sure.
The individual in Tennessee has been reunited with a family member and is out of place there and living actually in Florida.
So are we still responsible for him living down there?
I know.
okay, anything else on the payment register?
Only because I haven't asked this question before, so I figured it could be time. I saw in the payment register there are various, it'll say rent or rent assistance. So my question is, how many rent assistances or rents or helping with homes do we have right now?
That's a good question. So off of the top of my head, I know of two different families that we had been on a more consistent basis providing assistance to. Those agreements that we went in to provide those assistance was when we were using the ALEA MAC funds. And at the present time, we're continuing to support those. I think I shared with this board one of those circumstances that was helping to reunite a youth with their biological parent from an RCC, which is $12,000 to $15,000 a month. So around $300-400 a month, obviously more financial for the county to support in that way. So two of them, though, that I'm aware of that we have this ongoing support that we're providing. Sometimes things will pop where a family will be in crisis, they quickly get evicted, and we're helping. But those would be very, on very short-term basis, maybe it's a month or two that we're providing that sort of assistance to them.
Thank you.
Would it be safe to say that labeling mental assistance is a little misleading? Probably be more housing assistance, semantics. But
Right.
Okay.
And I'll just mention, if it's okay, in one of those two situations, we had worked with this parent on a step-down agreement. So each month, the amount that the county is helping to contribute to that housing assistance is decreasing, while the responsibility on the parent's end is increasing. So, the hope is that we're helping through this budgeting process too, to become fully, independent without the support of the county.
Okay, is there a motion to approve the payment register? Jan, second. Dennis, any further discussion? Seeing none, those in favor signify by saying aye.
Aye.
And it is approved as presented. Put your signatures on there that goes around the table.
There's two steps, yes. Sorry, one for the credit card purchases and one for the regular checks.
Okay, moving to point 3, employee update, resignation, retirement, and recruitment. On your packet, you have a letter from Brittany Schellenberger.
There, as noticed in the chart that's provided there, we continue to have, I'd say significant turnover at the moment, and I believe that will probably be slowing down. There's a number of different reasons behind that include both, a couple of retirements, some folks looking at just life issues, a couple folks due to COVID and not being able to meet family needs, and also continue to work. And then you have some folks that have decided to leave because of some decisions that were made in regard to the director and deputy director, as well as the issue with the league. So we continue to see some turnover. However, I think that's going to slow down real quickly. Now, outside of the COVID stuff, I think things are starting to settle. We are in the middle of recruitment for the management positions that are open, and those hopefully will be filled soon. It's a little bit stressful on staff as far as the number of open positions we have, but that continues to work done for the county.
Okay, moving forward, remote work discussion. There is discussion, as most folks know, on trying to draft and bring forward a remote work policy that would be a regular and ongoing policy for the county. However, what's happened most recently, and this has to, some of it was triggered by my own personal situation. A couple weeks back, about 3.5 weeks ago, I was diagnosed COVID positive. And what happened with that was I had close contact with a number of staff, and all of those folks had to go out for 2 weeks, including myself. But it brought to light a very challenging situation that we have. At the department, we are required to provide, the county is required to provide certain mandated services. We were this close due to my engagement with staff, following all the practices we need to practice. But still, because they had close contact with me, they had to be out. And we were this close to not being able to fulfill our duties. So that has led to a conversation with Andy and with others on coming up with a proposal to the board in regard to like an easy schedule, to where a certain number of staff are off-site working remotely for a period of time,
and a certain number are on site, and then after a period of time, they switch. And they switch back and forth until we can get through this, because we can't afford to lose everybody all at the same time. And interestingly enough, in the county's magazine today, there's an interesting article, if anybody's taken a look at it, but it's, managing a workforce during COVID-19, adapting to a new normal. And there's a statement, and it says, bringing too many employees into the workplace at one single time presents high risk of infection among employees, which in turn may require a partial or full shutdown. We don't want to get there. So that conversation is taking place. I know Mandy will be bringing that forward to the our committee real soon, but wanted to share that with all of you that that's what's taking place. I was not hospitalized. I thought I had a cold, and it was real similar to when I had the flu during the winter. There were, a few strange things that were occurring, but I thought it was a cold because my granddaughter had a cold. She had all the symptoms, was tested negative. My grandson then had the same symptoms and was sneezing on me, doing those things. I got the same symptoms and thought that was certainly the same thing, but followed me and always wear a mask, keep the distance, wash hands, do those things, and still snuck up and got them. So, anyway, that's what's going on as far as the conversation, and we'll be moving forward. Certainly, I think if anybody has any comments, Mandy would be more than happy to accept those.
Jerry,
Yes.
Mandy spoke to the IT committee, which is, half of the finance committee. And she explained that we have a remote interim policy. And that is becoming the remote temporary
Correct.
policy that we're anticipating will last until December. And they are still very much working on the remote, I don't want to say forever policy, because nothing's forever. But it's the idea that they felt they had to go to this temporary and continue it, like Ted said, with the A and B situation, so that everybody isn't in the same thing. As Mandy's 3-person office, if one person got sick with COVID, all of a sudden your whole office is down. So they're trying to work through those things. So I appreciate and know that she said their department heads are bringing it to every committee, so we know. And I suggested to her that sometimes it doesn't hit us correctly by county board, so it would be nice if she would also tell the whole county board what's going on at this particular point in time.
Yeah.
Interesting.
The reason the intent, is exactly so you don't lose everybody all at the same time.
Right?
And I totally agree that the full county board needs to be praised of what's going on and what progress we're making on this. Did Mandy indicate that she was going to bring it?
Mhm.
Anything else on remote work?
One question.
Yes.
I know when they work remotely, they get to take their laptop from here, but the county doesn't pay for the internet or anything like that, and the security is on the laptop itself.
Right.
Okay.
And also the majority of folks do not have access to the server itself. It's really email. And by server, we did have to, because Erica had to be out for 2 weeks, and the bill still had to get paid. So she was granted access to the server so she could get into all of the different finance things that she needed to do.
Okay. Director's report?
Just a couple things to share. We did have, at the last full meeting, we did have someone from the public come and share about their experience. We are, talking with those folks, and I don't want to go too far into it because we're in an open meeting, but we are trying to work through those situations. We do have a couple cases that are bubbling that you might hear about, a couple very active cases. So if anybody gets contacted by any of the law enforcement agencies that we're not working to take care of situations call and I can explain what is happening. One of the challenging pieces is there are things going on behind the scenes that some folks don't necessarily know, so I would be more than happy to share those things with everybody. I am going through a process of looking at certain policies that we have within VHHS and looking to align those a little differently with the county policies. For example, one of those is the hiring practice and policy and recruitment and interviews. We had moved towards almost always having 2 different interviews with candidates in the department. We're going to move back to mirror the county's policy in order to be able to streamline and facilitate hiring in a quicker manner. But we're looking at a number of those possibilities. We mentioned the individual from Tennessee. And get back to the issue of recruitment and folks leaving. I do think that's going to slow down. And that's all I have.
Yeah, I just want to mirror from what Ted has mentioned about interviews, second interviews, and so on and so forth. I've been doing the interviews with department managers and sometimes department heads or Mandy coming up for, and it was always surprising to me when somebody said we need to have, and I'm talking about somebody who's a manager, we need to have another round of interviews with these people. As Ted has mirrored, you don't really learn anything more on the second interview in almost all cases than you got on the first interview. You go through their recommendations or in their resumes. You rely heavily if you have them tested by Dr. Pico, and meaning that you felt that there were real possibilities with these people. And that's Dr. Pico, for any of you that have ever had any contact with his work in that, he is excellent at finding the real person as far as their various characteristics and that through these tests that they've been invaluable help to us at times. Sometimes we think we've got somebody that's really, really good. And then Dr. Pico's test comes back and he points out that maybe in this area, not as good as you'd like to have, and it's caused us to rethink on occasion that person. But as far as bringing us all together again, the people up on the second floor, the managers, Ted, Mandy, not myself, I've got plenty of time, but I mean, they have to be there often, and they've got other things to fill their day rather than second interviews and so on. So, not saying we never will have a second interview, but we're going to really try to cut back and be more efficient on the first interview. So I'm glad that you brought that up, because I felt that for a couple of years or more. Yes.
It's not interviewing. So my question is this, Ted. Because I sit on Crime Stopper board, and I get anonymous concerns about individuals in the world, do I come to you first if there is a abuse situation, or do I go to the officer?
That wouldn't be talking about a child.
Yes.
Well, you certainly could go to law enforcement, but they would probably direct you to our intake process. They will walk anybody through a series of questions and a process to ensure that the proper information is obtained and whether or not it really gets screened in to a deeper level of involvement and engagement. But it would be a call to the intake.
So go to you first instead of to the officer.
Well, you certainly,
If there's drugs involved.
well, you certainly can, but if it's a child abuse and neglect possibility, it really has to go through our intake process. That's the kind of the statutory and administrative rule guide that allows us to engage into the life.
Oh, I took it to the sheriff's department, so
Yeah.
I don't think it's you.
And you certainly can, you can bounce things off them, but in order to get into the process, in order for us to have a legal ability to engage folks, it needs to travel that path.
As we know, sitting around, we all got a letter from a person who had a problem with the second floor, I shall say. So Ted, what should be our response to other county board supervisors who maybe ask us as EHHS committee members, what's going on?
Sure, I think what you can say is it will take a very formal grievance process what that is established. Anytime there is someone who may file a grievance with the department, I have not seen that, but if the letter you're speaking of, but anytime that there is a problem, a formal problem with a service which we provide, it travels a very formal process. And Liz actually is the first step in that grievance process. And then she will take us through that. And I can, at the next meeting or even after this meeting, this next week, I will share what the grievance process is. But anytime we receive something like that, it is addressed, it is taken care of. Maybe not to the satisfaction of the person filing the grievance, but it does take a very formal process.
Okay, thank you.
You bet.
And I think all of us have been around the block often enough to realize that these people that often call us, they are very, very concerned, they're very forthcoming with it, but I found personally, the less I talk about it over the phone, the less chance I have of making a mistake. And I'm more than happy to acknowledge their concern and say, I'll bring it up to Ted, but more often, they should bring it up to Ted. Because I'm not trained in all the nuances of social work and all of the things that are going on. I don't want to blurt out something that is totally inappropriate as far as for the situation and that. So I'll dump on Kevin.
Well, I think there's a proper protocol that we have to follow. And so you're right, I don't talk about it. With someone who calls, I refer them directly to the person. I mean, it's good to know what are the numbers and who are the people, and you go to the people who are involved with it, because I, as a county board supervisor, can't do anything.
And it's good that we know when there is a concern, and we ourselves can, go to Ted and say, well, have you heard from Mrs. Jones or Mr. Smith about this particular thing? They called me the other night, and we can get some filling in as to what it's all about.
Thank you.
Okay. Kevin said that we can get this meeting done in 1 hour or less, and that's why I'm stalling.
Check the clock.
Okay, come on, Jerry, speak. Are the director's report done?
Yep.
Okay, moving on to the board member reports of meetings. I'm sure there must be several. Anyone?
I went to that one that I expressed before, and I find these meetings very beneficial because seeing what other counties are doing. And Ted, I hope you can come to the next one, which is going to be across the state again, because I don't have that right to say you can have it here. And somebody has to speak up and say, we can host it or not host it, So it is across the state. And I already told them I probably would zoom in because of and the weather.
Yeah, we can talk about that.
Any other meetings or conferences that you know, on?
I watched today the webinar on the First Amendment rights. That was from the WCA, and I thought that was really interesting, and it affects how we as a county handle it. And Andy said that we should probably, don't have to, but it's nice if we have an ordinance. And then we have a policy. And then we have signage. And what he's talking about is, let's say somebody comes in with a camera and wants to film. Any place that it's public, it can be filmed. Any county official that's doing their job can be filmed. But if you're in a private area, let's say Erica is in the back in her office, and we have said that is not accessible to the public. All you have to do is have this policy and then have the signage there. And then they also suggest that you, of course, saying, employees only, you're not accessible, and lock the door so that they can't get in. And the other information that they gave basically was, the people coming in and doing that are looking for attention, and they're looking to try and rattle you. So be very calm. Let them film if they want. You're not doing anything wrong. If they ask you your name and how to spell it, you don't need to tell them. I thought that was interesting. And so it was just really informational, and I thought it would maybe be important for us because they talked about a county that had a DHHS building that was just for them. And they were talking about what if they come into the lobby. Well, you're dealing with clients, so they have a right to privacy. They should not be able to film a client who's in the lobby. But you need to have that. He says an ordinance is best, but if you have a policy and then the signage that says no filming, then they can very easily defend what we're doing and what First Amendment auditors cannot do. And I thought that would be important for us because we do have clients that come up to the lobby on the second floor. And maybe we do need to have signage for a policy. And I thought I'd just bring it up so that you all can think about it and see what you do. And I know that WCA has put just a slide presentation on their website, WCA, and it's under today's First Amendment one. So that's all I have to say. So we get done by the time the jury loses the cat.
I have a report. Probably take 10 minutes. No.
I have one. I did the Wisconsin County seminar on cybersecurity, rising threats to the public. And that really was why I was asking questions about the work from home, because it said even like transferring a USB and the threats are rising and how easily people can get into the system. And it was very interesting. I took a whole page of notes, so it was interesting that the threat to the public safety is on the rise.
Anyone else? Okay, we're entertaining a motion to adjourn. Jan, Dave, second, those in favor?
Aye.
Aye. At 1 minute.